Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. So today we are going to study about the clinical findings of Treponema Pallidum. What are the clinical findings of Treponema Pallidum? And this is the second lecture about the Treponema Pallidum. So let's start. So as we have already discussed that the Treponema Pallidum causes the syphilis, and this syphilis may be acquired or congenital. So first talking about the acquired syphilis. So the acquired syphilis is mainly divided into three stages: the primary stage, the secondary stage, and the tertiary stage. First talking about the primary stage. So the primary stage is mainly characterized by the lesion which is called as chancre. And what is chancre? It is a local non-tender ulcer, and this local non-tender ulcer heals spontaneously. It forms in about 2 to 10 weeks, and in this stage the spirochete multiply at the site of inoculation, and this results in the formation of chancre. And if this primary stage is left untreated, it can result in bacteremia and cause the other complication. Now let's jump into the secondary stage, and this secondary stage, it occurs after about 2 to 3 months. 2 to 3 months after the primary stage, and it is characterized mostly by the maculopapular rash, and it is mostly on the palms and soles. This is soles of hands and foot, and also the mucous patches, which are also known as the moist papules, and they are mostly present on the skin and mucous membrane. And if these mucous patches or moist papules are present on the genitalia, then they are called then the condylomata lota. Condylomata lota. And this condylomata lota, they are rich in the spirochetes, and they are highly infectious, and they also heal spontaneously. They are rich in spirochetes, highly infectious, but they can heal spontaneously. The other sign and symptoms or the characteristics of secondary stages, pachyalopecia, as you can see, the pachyalopecia, pharyngitis, which is inflammation of the pharynx, meningitis, nephritis, hepatitis, and the constitutional symptoms like fever, malaise, etc. These are the some characteristics of the secondary syphilis, maculopapular rash, mucous patches, pachyalopecia, pharyngitis, meningitis, nephritis, hepatitis, and constitutional symptoms. And the important point which is to keep in mind that in some people the symptoms of both the stages, i.e. the primary and secondary stages, do not appear, and yet the disease can progress into the tertiary stage. So let's talk about the fate of primary and secondary syphilis. The fate of primary and secondary syphilis. So it is the most important. So the first one, about 1/3, i.e. if 100 people get the syphilis, then about the 33% they cure without any treatment. They cure without any treatment. And the other 1/3, i.e. another 33%, the syphilis become latent, i.e. the Treponema Pallidum become latent, and this latent period is characterized by the latency is characterized by a latent period which may be an early latent period or the late latent period. In latency, although the serological tests are positive, but there are no lesions on the body. There are no lesions, but the serological tests are positive. So now let's talk about the latent period. It may be early latent period or the late latent period. The early latent period, it lasts about for the 1 to 2 years, and it mainly occurs after the secondary stage. The symptoms can reappear, and the early latent period is highly infectious, while the late latent period lasts for more than 2 years, and the symptoms do not reappear in the late latent period, and it is non-infectious, i.e. it cannot be transmitted to the other person. Now the another one third, i.e. 33%, they progress into tertiary syphilis. Tertiary syphilis. Now talking about the tertiary syphilis. So it is mainly characterized by the guma, which are the granuloma especially of the skin and bones, neurosyphilis, in which the CNS is involved, and it is made in the form of tabes and paresis. What is tabes? Tabes dorsales, it is a late consequence of neurosyphilis, and it is characterized by the slow degenerative, specifically a demyelination of the neural tracts primarily in the dorsal root ganglion of the spinal cord. It is characterized by the slow degeneration of the dorsal root ganglion of the spinal cord. It is called the tabes dorsalis or the tabes. And the other is in the form of the paresis, and it is characterized by the partial paralysis due to the nerve damage. The other characteristics of the tertiary syphilis, it is in the form of the CV cardiovascular lesion, and it may be in the form of the aortic aneurysm of the ascending aorta. And the other most important point, that in the tertiary syphilis, Treponema pallidum are rarely seen in the lesions. So these are the gumas present on the nose. These are the gumas, and this is the picture of the testicle, in which the guma or granuloma is present inside the testicle, and it is the picture of the aortic aneurysm. Now, as we have already discussed, that there are two types of syphilis: the congenital syphilis and the acquired syphilis. So the congenital syphilis is mainly due to the transmission of bacteria through the placenta from mother to fetus, and it typically occurs after the third month of pregnancy, and it can result in the death of the fetus, or if the fetus survive, they will have the following features, like the skin and bone disease, like the Hutchinson's teeth, mulberry molars, saber shins, saddle nose, rigidus, snuffles, which is noisy breathing, and the frontal bossing. We will discuss each one of these. So this is the Hutchinson teeth. And what are Hutchinson teeth? They are the triangular or peg-like shaped teeth, especially the incisor and molar. In Hutchinson teeth, the incisor and molar take the form of triangular or peg-like shape. This is the mulberry teeth, and it is characterized by multiple rounded enamel cusps on the permanent molars. As you can see, these are the cusps, permanent rounded enamel cusps. You can also see the saber shins. It is characterized by the sharp interior bowing of the tibia. You can also see the saddle nose, which is characterized by the loss of height of the nose, and the rigidus, which is characterized by the fissure, cracks or linear scars in the skin, especially at the angle of mouth and nose. As you can see, these are fissure, cracks or linear scars in the skin, especially at the angle of mouth and nose. Rigidus, and this is the frontal bossing of the forehead, characterized by the pronounced forehead. The other sign and symptoms of the congenital syphilis, beside the skin and bone involvement, is in the form of hepatosplenomegaly, the interstitial keratitis, which is characterized by the scarring of the cornea. As you can see, scarring of the cornea, and there is also the eighth nerve deafness.